there, this is Maggie Wooden. Welcome to my Health and Goodness channel. This is part of my Stoveside Chat series, and I'm excited about this video. I've been thinking about it for a while, and it's about knowing your numbers. I bet you're wondering what that's about. I'm going to first cut to the chase. The initial part is about a lot of statistics. And some of them are pretty alarming, actually. We have a serious problem, and it's affecting millions of us. And actually, there's over 200 millions. 2 out of 3 Americans are overweight or obese. According to the U.S. Office of Minority Health, 4 in 5 African American women are obese. Carrying those excess pounds increase the risk of certain cancers, like colon cancer, even some types of breast cancers, type 2 diabetes, high blood pressure, stroke, heart disease, and it affects our mobility and sometimes even our self-worth. And February is Heart Health Awareness Month because heart disease is the #1 killer. Even for women, it is not breast cancer. It is actually heart disease that's the #1 killer. In fact, 1 in 3 women are diagnosed annually with heart disease. Heart disease hits close to home for me, actually. One of my brothers had a heart attack when he was in his 50s, and then 11 years later, he passed away in 2018. That was really hard for me and hard for my mother and my other brother and the whole family and his children and his wife and his friends. So my mother has suffered from heart disease. She's had 2 surgeries, and so I felt compelled with my struggle with weight that I needed to do something, especially with the other health issues that I had, that I needed to do something right away. So I started working on myself, on getting my weight in control. And especially now when you look at adults with heart disease and some of the other pre-existing conditions that we've mentioned, and obesity, they are at higher risk of severe illness or even dying if they contract the COVID-19 virus. And so for me, that's even more of a compelling thing, that people need to take this even more seriously. Whatever you can do to get yourself on a path to just take care of yourself. Take care of yourself for you. Take care of yourself for your family and your loved ones. And this is the year to really start doing that. Let's focus on the numbers that measure the risk factors associated with obesity and some of these diseases we've talked about, shall we? So for the first and foremost, I would recommend that, if possible, make an appointment with your physician, with your primary physician, if you haven't done so yet, for your physical, and then they can do some of these blood tests that are required to get an idea about some of these numbers that can, where you can assess where you are for some, from a health perspective. So some of these first numbers that matter that we're going to talk about require that you take these blood tests fasting, typically about 12 hours. So the first one is the blood glucose number, and that's the one that you take. That's to assess whether you have diabetes or if you're pre-diabetic, and it has to be less than 100 milligram per per DL, and so that one will determine whether you are pre-diabetic or if you are diabetic. So that's a pretty important number for the doctor to assess for you, and so make sure that's included in the blood test that they take. The other one is the hemoglobin A1C, and that one, the levels between, and this one will vary, the levels between 5.7 and I believe it's 6.9, 6.4 mean you have a higher chance of getting diabetes. Lower or higher numbers, targets may be appropriate for some people. It depends. Talk to your primary physician about that. I remember in 2019, in the summer of 2019, my number in particular was like 6.9, which was kind of high, and so my physician was very concerned about that, and so that was one of the things that kind of scared me, and so he definitely believed that I was pre-diabetic and needed to do something about that. The other one that you need to take, and you also have to fast prior to you taking this blood test, is it's what's known as the lipoprotein panel, and it includes the total cholesterol, the HDL, the LDL, and also the cholesterol and the triglyceride. The total cholesterol number is measured, and typically that one, if it's higher than 200, that usually means that's cause for concern, and if typically it's higher than 235 or 250, the doctor's the total number, the doctor typically requires that you may not only need to make some lifestyle changes, but you may also have to consider taking some statin medication to take care of that. And then the triglyceride number is usually reflective that you have a high level of carbohydrates that you are consuming. Also can affect a high risk for heart disease as well. So they'll typically ask you to reduce the amount of carbs that you are consuming in regards to that. So the other one that they'll typically, so obviously when you go to the doctor, one of the first things they do is they monitor, they take your blood pressure. But one of the things that you probably should consider is to get a blood pressure monitoring system. So we have one at the house. Here it is. So you can buy one at your for yourself. You can order one from Amazon or get one from your pharmacy or from Walmart. And if you suffer from high blood pressure or your family has in the past, it's a good idea to take your blood pressure on a fairly regular basis. High blood pressure, as you may know, is the silent killer. And so you really want to make sure you keep that in check and monitor that on a regular basis. And so that's probably a good one to monitor regularly. Another thing that is a good idea to do is to your waist measurement. You want, for the women, your waist measurement should be 35 inches for women and 40 inches for men. So a regular tape measure. So tape measures are, you probably have one of these at home. So tape measures are just not for measuring furniture that you may want to change or things like that, but it's for measuring your waist. It's a good idea. If you don't have one, you can get one at Walmart or something like that. But to measure your waist, and that's a good indication. Again, fat belly increases your risk of diabetes and heart disease. So again, ladies, it should be less than 35 inches. And so again, from a weight management perspective, that's a number you want to keep tabs on and take care of, and certainly monitor on a regular basis. The next one we're going to talk about is to aim for a healthy weight. And I have to say, I've had a very dysfunctional relationship with my scale. For quite a while, I kept my scale in my closet. So I don't know about you. I just didn't like weighing myself. I didn't want to know how much I weigh. Or I had an idea I had gained weight, or you know, because every time you go to the doctor, they certainly tell you how much you weigh, but it's not something I wanted to monitor personally. And so I decided when I was making this change last year that I needed to come to grips with this. So I changed my relationship with my scale, even to the point that I named my scale Claire. So Claire and I have a new relationship now, and she is out of the closet, and it's best. It's best that she's out of the closet now. And so and see, Claire is like a good friend. She tells me the truth. She tells me the truth about my weight, when I've gained weight, and when I've gained a few pounds. I know that I need to scale back and get myself back in and start to get back on track. And so I keep it right outside my bedroom. My husband and I, several times a week, actually I weigh myself pretty regularly. We weigh ourselves just to make sure we're keeping on track, especially when I'm trying to lose weight. I do that almost daily. Not everybody believes in that, but personally that helps me to be accountable. Whatever helps you, you do that, but I think it's important for you to certainly, especially when you're on a program, to weigh yourself on a fairly regular basis, but you weigh yourself at the same time that on that week, on that day of the week, whether it's the morning or whatever you've chosen to do so. So that's what I'd say about the scale. And then the other thing is the body mass index. So the body mass index is derived by taking your height and your weight, and you can enter it into a calculator. There are calculators that you can use online. There's one that the CDC provides. There's several of them, and I will enter them in my comments area as well. The average, or the ones that's best, is between 18.5 and 25. And so anything that's over that, you're more at risk again for heart disease. That means your body has more fat, and therefore you tend to be more at risk again for cardiovascular disease, and you need to keep that in check. Okay, so those are some of those numbers to keep track of. And then the last number that matters is one close to my heart. It's John 3:16. For God so loved the world that he gave his only begotten Son, for whomever shall believe shall not perish but have eternal life. And the Lord will give you the strength to do whatever you set your mind to do. And so I've struggled with my weight for a very long time, almost all my life, and dealing with these with my weight issue and these health issues in the past few years. I finally have come to the point where I've been able to get them on to more or less get them on track. I hope this information is useful, and hopefully you're motivated to get your health into your own hands. And for some of you, making some of these lifestyle changes that are required to get your weight under control, you can do that with lifestyle changes. For others, you may need extra help, and you should seek that help. My hope is you will find whatever health prescription is best for you, as my friend Joetta often says. That's what this channel is all about, is to help you and motivate you and show you that there's options out there to assist you. So I hope you will check the thumbs up, the thumbs icon if you like this video, and subscribe to my channel for more videos to come. And may mercy and goodness follow you all the days of your life. And we'll see you on the next video. Okay? Bye.